Hello, this is Melissa with Medical English Melissa, and you're here for another episode of Medical English 5-Minute Clinic. So in the next 5 minutes, I'm going to try and fit in as much medical English information as I can, and then you could always ask me questions in the comments. So today I'm talking about skin and words you might hear patients use and words that you might use when describing it to a colleague. So here's what I'll be talking about. To break out, to appear out of nowhere, to resolve, to develop, to calm down, to show up, to go away, to apply something to rub something in, to keep something out of something. Red, reddened, redness, and the difference. Swelling, swollen, psoriasis, eczema, jock itch, ringworm, athlete's foot. I'm going to try to cover all of these, so let's get into it. I'm going to move through these super quickly so that we can cover a lot. So first, to break out. This is a phrasal verb, and this is what we use when we're talking about skin, when you have something appear on your body like a rash or hives. It's to break out. And something to point out is a person breaks out in something. So a person breaks out in a rash. Another way to say this is developed. So someone could break out in a rash or they could develop a rash. You could also say that a rash showed up. You could say that a rash showed up out of nowhere. So you might ask the patient, were you doing anything in particular? Were you doing anything specific when the rash developed, when you broke out in a rash? And they might say, no, it showed up out of nowhere. If someone has a chronic issue, like psoriasis, like an autoimmune issue where they have reoccurrent skin issues, it's often called a flare-up. Someone can have a flare or a flare-up of something, or the disease itself can flare up, or you can have a flare of the disease. The opposite would be to resolve. So a skin issue can resolve. A patient might say that it went away or calmed down instead of saying resolved. Before I go any further, as some of you might already know, I have started my Medical English online course waitlist. So if you're interested in it, there is a link below and you can sign up. There's limited availability because it will have a Zoom component and the people on the waitlist will get a chance to register first. Okay, so there is the color red. We say that things can be red and swollen. So red and swollen, adjective, adjective. You can also say that something is reddened, and sometimes you'll hear that used interchangeably with red, like there's a reddened area on someone's skin. Now there's redness and swelling, and these are the noun versions of it. So something can be red or reddened and swollen, or they can have redness and swelling. Okay, so here's where I think it gets a bit trickier. We're going to talk about prepositions and things that you do to and on your body. So when you're talking about applying a cream, so you would say to apply something to the affected area. You apply something to something on the exterior part of the body. So you would say that you need to apply a cream to the skin. You can apply the cream to a wound. But then if you want someone to have the cream be absorbed, you say to rub it in. Put something on, or you apply to, or you rub in. So apply to, right? To is the preposition. Put on would be the preposition. Rub in, that's a phrasal verb, right? So you just rub something in, means to have the skin absorb it. So where to put something. This is kind of too big of a subject for 5 minutes, but around the eyes, between the eyes, around the nose, on the nose. There's a lot of different prepositions here, but we'll save that for another time. If you're advising the patient to not do certain things, you might use phrases like keep out of or keep away from. So you could say, when you use this medicine, you need to avoid direct sunlight or you need to keep your skin out of the sun. So keep out of, maybe you need to tell someone to keep something away from water. So away from, out from, these are more helpful phrases. So jock itch, ringworm, athlete's foot. All three of these like there's no way you could figure out what they are from the names, but these are what we call different fungal infections. And I've noticed in a lot of languages, they don't translate literally. And so, these are different names for like various infections. So like jock itch is in the groin area, athlete's foot is like the foot, for example. So 2 words that are really difficult to pronounce in English, even for people who speak English as a first language. Psoriasis and eczema. So egg, like an actual egg, and eczema. And look where my emphasis is. Eczema, and then psoriasis. It's just a tough word to say, but you're going to go up on the rye part. The syllable stress will be on the rye part. Psoriasis. Bonus. So you might know the term pimple. You might hear someone from the US call it a zit, or someone from the UK call it a spot. These are slang words for pimples you might hear. If you are enjoying these free medical English YouTube lessons, make sure that you like, subscribe, and hit the little bell button down there. And it's the best thing you can do to support the channel. And that's all for this lesson. I will see you in the next episode of Medical English 5-Minute Clinic. In the meantime, if you want to get a hold of me, you can find me in all of these places. And of course, on my website. That link doesn't actually work. You can use the link down there. I will see you all next time.